If you have arthritis in your thumb, you may notice trouble gripping things, opening doorknobs, taking tops off of jars, or doing crafts or other tasks that require fine motor skills of your hands. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 7 tips to help relieve pain and improve your function if you have thumb arthritis. So first of all, what is thumb arthritis? Thumb arthritis typically happens at the carpo-metacarpal or CMC joint. That's the joint right here where your wrist technically joins with your hand, a bone called the metacarpal. You have your carpal bones in the wrist, the metacarpal, and then 2 phalange joints that join with that. Now, when most people think of their thumb joint, they think of this joint right here called the metacarpophalangeal joint. But the joint that typically gets arthritis is right down here at the base of the thumb. And so it's actually part of your wrist. And so the first tip to help with CMC or thumb arthritis is going to be a wrist mobilization. You need to have proper movement of the 8 carpal bones in your wrist, but particularly the one that joins with your thumb called the trapezium. To do that, you'll stand up and put your hand on a flat surface that's roughly about waist height. Then you'll take your other hand and put it over top of your wrist, right at where the crease is. Then you're going to bend using your hand sort of as a fulcrum. So you're pushing down with this hand and then hinging back and forth over the other hand. This gets the bones in the wrist moving more properly and sets you up for the actual thumb exercises, which are going to come next. Now, the next exercise isn't technically an exercise per se, but this is probably one of my favorite tips for thumb arthritis. It feels great and often gives you instant relief. So what you're going to do is you're going to take your opposite hand and you're going to put the pad of the thumb of this hand on the thumb joint or CMC joint of this hand. You're going to grip around the thumb, but you really want to try to pull on the metacarpal, not on the phalangeal joints right here. So get a nice firm grip where your thumb is right at the bend where your wrist meets your hand, and then you're going to grip around the metacarpal and the fingers and then just pull out like that. I'm showing it this way so you can see the joint a little bit better. In reality, it probably looks a little bit more like this. You can do a sustained pull or sort of oscillate back and forth, but that separates the 2 joint surfaces. And if you have pain inside the joint from those 2 joint surfaces rubbing on one another, then it feels really good to take some of that pressure off. Sometimes you may hear or feel little pops or crunches, and as long as they're not painful, that's okay. Often they actually feel pretty good. Now, why does the thumb joint get stiff in the first place? Well, we use our hands a lot during the course of our lives, and over the years, particularly if you have a job or other tasks that you do repetitively over the years that use your thumb or gripping a lot, the muscles in your hand, particularly in this piece of meat right here called the thenar eminence, create compression between the 2 joint surfaces. Now, one of the most common ones that causes problems in thumb arthritis is a muscle right here, kind of between your thumb and the metacarpal of your first finger, and that one does this motion. It's called the adductor pollicis. Adductor meaning pulling this way towards the hand, and pollicis meaning thumb. So you're going to pinch on that adductor pollicis. This is the 3rd tip, which also again isn't really an exercise, but feels good, is probably going to do you more benefit than the exercises that I'll show you later. So you pinch right on that adductor pollicis, and it's a big 7-shaped muscle. So feel around for the spots where you feel some tenderness or soreness, and then just squeeze gently. If you find the right place, you're not going to have to squeeze very hard. So even if you have some trouble in this hand, if you get to the right place, it's going to be pretty exquisitely tender, and you're not going to have to pinch very hard in order to get a treatment effect. Once you find a sore or tender spot, hold pressure on there for about a minute to a minute and a half. And as you do that, that tension in that muscle should slowly kind of melt away and get less sore. You may have to find a couple different spots throughout the hand, and you may even look down in this part of the thenar eminence right here and see if there are some other muscles in there that you find tender. So that's the third tip. Now the fourth tip is actually an exercise, and it's extension of your thumb. The thumb joint is a saddle joint, so it moves in two directions. It moves away from the palm like this, and then it also moves away from the palm like that, like an alligator mouth. I know those seem kind of similar, but they're actually two different planes of movement. So those are going to be the next two exercises, actually. You're going to take your hand and put it like this and do extension, flexion, extension, flexion, extension, flexion, back and forth, trying to focus that motion mostly around the CMC. So extension and flexion. The next exercise is for abduction, moving away from the palm, and adduction. And again, you're just going to go back and forth, thinking about moving around that CMC like an alligator mouth about 10 times each direction. So pretty easy, right? Well, the next exercise is called opposition. It's a combination of several movements. Your CMC joint moves across your palm, your MCP joint flexes, and then your little finger bends as well to meet it. So this is a combined movement. Sometimes people lose range of motion here, and if you have lost range of motion, you can kind of help it along with your other hand in order to get to opposition. If you can't get all the way to your little finger initially, just go to your ring finger or to your middle finger, and as you improve your range of motion, the goal is to try to be able to get thumb to little finger. So that's opposition. The last tip is wearing a thumb spica brace. Again, arthritis in your thumb is an overuse condition. It's caused from repetitive use, repetitive stress on the thumb joint over the years. And if you're having a flare of thumb arthritis, wearing a thumb spica splint that goes around that CMC or thumb joint, around the base of the thumb, is a good idea. Now, because it immobilizes that CMC joint, which also joins with the wrist, it's probably a good idea to have a brace that crosses the wrist and not just one that's based on your hand. You get a little bit better immobilization. Now, I'll put a link down in the description below this video of a thumb arthritis brace that I think is good and helpful. Now, if you are in the St. Louis area and you need some more help for thumb arthritis in your hand, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else and you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.